My name is Tiffani Brown. I'm going to be talking to you all about midwifery in America and the transition it's made over the years. I also want to talk about have you acquire a deeper understanding of what midwifery is and the role it plays today in today's society. While hospital care is thought to be safer and doctors considered to be more equipped to do birth, midwifery care is actually tested and known to be just as secure and in some cases better than hospitalization or care. Several studies have concluded that midwifery care has better outcomes and pretty much superior to those to the physicians with same patients. So if you have the same lady, the same mother who's going to have a natural birth, midwifery care is actually known and proved to be a little more superior than taking her to the hospital because they're taught to deal with sickness. And pregnancy isn't a sickness at all. The U.S. spends about $86 billion on pregnancy-related health care, and we are still 49th in the world, the 49th country to the worst maternal mortality outcomes in the world. So out of all of the countries, we're still 49th, even though we spend so much money on pregnancy-related health care. A mother in the U.S. is 5 times more likely to die at birth or her baby than in Greece or Spain or most European countries, and even some third world countries. We're still 5 times more likely to pass away during birth or have something happen to our infant in the hospital. Since 1990, maternal mortality rates have doubled, and since 1990 we've also seen a rise in intervention, so there's some connection there. We're doing a lot more C-sections, scheduled C-sections, vacuum extractions, so on and so forth. Episiotomies, which would be maybe a little graphic, but where they cut you. There's a lot of interventions that are happening unnecessarily. It's pretty much to convenience the doctors and nurses, and it's a business. Hospitals run a business, so they have to have things on a certain time frame and move on to the next patient. Hospitals charge about $12,000 on the low end of things for a cesarean section. So if you've ever had a baby and you've noticed that they're kind of pushing C-sections on you, that's because they make more money to do so. And then for a normal birth in a hospital, you're looking at about $6,000. So if you want, you don't want any surgery, what they consider a normal birth would be a vaginal birth. With a vaginal birth, they can still give you interventions such as Pitocin, which would speed up your contractions and make them a little bit stronger. And the IVs, different drugs and things that they can do. That's about $6,000. And more than 80% of women in America have normal pregnancies, so there's no need for all of these interventions at all, which is what brings me to why it's been proven that midwifery is superior in that nature, because it doesn't use any interventions. It does everything naturally. It lets your body work on its own, essentially. Midwives are specialists in normal pregnancy and focus on maximizing prenatal wellness and natural birth. A midwife literally means with women. So a midwife focuses on the woman from prenatal care all the way through pregnancy. It's not like an OBGYN that you see once a month and then maybe the last 5 or 10 minutes of your birth experience. She's there with you the entire time. Midwives are the main caregivers to childbearing women worldwide, and the health care with a midwife normally starts at about $3,000, so that's a quarter of what it costs to have a cesarean and half of what it costs to have a natural birth at a hospital. Midwives are trained to recognize any complications that affect the health or safety of a mother, and will consult a physician for any complications that arise. So what an OB is there for is for emergencies. They are trained to do surgeries, and they are trained to come when there's an actual problem. That normally doesn't happen again. So, because like I said, the 80% of women that have natural births. And in the early 1900s, OBs got introduced, and they started kind of shooing the lay midwives or the granny midwives out of the country, which were like the immigrants that came from different countries, and they were the main caregivers for pregnant women. They kind of shoo them out of the picture, and because they realized that it made them a lot more money. So you start seeing more men become physicians and OB caregivers, and taking over that arena. Midwives believe that pregnancy and birth are normal processes, and they provide personalized care based off of that, which perpetuates better outcomes. The midwifery model of care has been proved to reduce incidental birth injury, trauma, and unnecessary C-sections or interventions. The most important reason why midwifery care is important in the United States is because it takes a natural process and leaves it alone. It does not start to instigate situations and make it where it can become dangerous for us to have babies, because our bodies know what they're doing already. The goal right now in America, or in our society, is a midwife for every mother and an OB for every emergency situation, which aren't, like I said, about 20%, so there aren't very many. I'm going to conclude with a quote by Ina May Gaskin, which is a midwife who started in the 1970s, and she started kind of a revolution to lead us where we are right now. She says that many of our problems in U.S. maternity care stem from the fact that we leave no room for recognizing when nature is smarter than we are. So that happens in almost everything in the healthcare system in the United States. So we try to take over and play God, and it's not necessary because it's costing us our lives. And that is it.